Hey Amarillo, I'm Jason Boyett, and you're listening to Hey Amarillo, the interview podcast featuring some of the most interesting people and stories of Amarillo, Texas. This week's episode is supported by Wieck Realty. I have recorded every interview over the past year in my home studio, including this interview. My family and I love our house. We love our neighborhood. We're here because Wieck Realty helped us sell our previous home and buy this one. Wieck is invested in seeing Amarillo flourish economically and socially for all groups of people. So if you're buying or selling, if you're building, if you're looking for investment property, or if you're a first-time homeowner, talk to Katie Wieck or one of her outstanding agents. That's wickrealty.com, W-I-E-C-K. And as part of this podcast partnership with Brick & Elm Magazine, I want to give a podcast shout-out to Leslie Massey, Farmers Insurance. The new September-October issue of Brick & Elm is out now. The feature story is about the small local producers you can meet at the Amarillo and Canyon Farmers Markets. Look for it on newsstands or visit brickandelm.com. Today's guest is Dr. Whitney Dowd, who is a doctor of nursing practice. She's a nurse practitioner, and she's worked in the local healthcare world for more than 15 years. She's the owner of Blumologie, which offers primary health care, women's health and hormone services, skin care and aesthetics services, and other specialized wellness care for patients here in Amarillo. She's been a nurse since 2008 and has a really interesting background, including several years treating patients at the J.O. Wyatt Clinic here in Amarillo. Whitney is also an assistant professor of nursing in the Laura and Joe Street School of Nursing at West Texas A&M. So we talk about her upbringing in Amarillo, her journey through the medical world, and how she ended up going the entrepreneurial route and opening her own practice and med spa. Here's Whitney Dowd. Whitney Dowd, welcome to the Hey Amarillo podcast. Thanks for being here.
Hello. Thank you for having me.
Yeah, absolutely. It's an honor to have you. I know that we've been trying to schedule this for a long time, so I'm glad that our schedules finally aligned. I want to start with you the same way I start with all my guests, and that's just to ask you why you're here. So what brought you to Amarillo in the area in the first place?
So I'm actually an Amarillo native. I was born and raised here. I graduated from Tascosa High School, class of 2004. I went to WT, so I'm an alumni of West Texas A&M University. I raised my kids here. They go to Tascosa. This is home.
Okay. Fully immersed here.
Yes,
then.
absolutely. I moved away for 1 year.
Oh, did you? Okay.
I went to college in Arlington for a year and immediately came back. Like, this is my place.
Okay. Do you know what brought your family here in the first place? Do you have any sense of that?
Not really. So my parents are both from small towns. My mom's from a small town called Hamlin, Texas. Okay. It's about an hour north of Abilene. My dad is from Kittiquay, Texas. Okay. They both grew up in small communities, and, you know, when they graduated from high school, they wanted to move to a big space, and this was just the place where people came. Okay. So my mom came here because my aunt was here, and my dad, it was the closest big city that I guess.
Everybody's decided, sort of drawn to Amarillo from the rest of the Panhandle.
Yes. So that's how I guess I ended up here.
So you said you left for a year in college. Was it one of those things where you just were one of those kids you wanted to get out?
Yes.
So your oats experience life in another place?
Exactly. Like I thought it was something that I needed to do. Mm-hmm. And I did it and figured out that, you know, Amarillo was a better place for me at that time, and so I came back home. Did
you know what you wanted to do? Like, did you know immediately you wanted to go a nursing path or medical, anything like that?
Yes, I've known from a very, very young age that I wanted to be a nurse. My grandmother, my mom's mom, she was a caretaker when she was alive. She was always taking care of, quote unquote, older people. As she got older, you know, they were younger than her, but that was something that she did. And so in the summer times, we would go stay with her, and that's what she did. She took care of people. And so she exposed me to that. I feel like if she was born in a different time, then she would be doing what I'm doing. Okay. She would be a nurse or a nurse practitioner or a physician. I don't know.
Those options were not available for her.
Right, exactly. You know, seeing what she did, that's what fueled me to do what I do.
I know that you're in a place right now of leadership and entrepreneurship, but what did your nursing career look like? You know, right out of WT, what was your path?
Well, it's been kind of a tumultuous, is twisty turny. I don't know what the technical term is for it, but it's been definitely a path. So I had my children very young.
Okay.
I have a son and a daughter. I had my first kid when I was 20. So I was not done with college. I was kind of still trying to figure out. I knew I wanted to be a nurse, but not sure where. And so I had my daughter. I ended up going to LVN school at Amarillo College.
Okay.
Great program. During that program, I actually ended up pregnant with my son. So I had my second child right when I was finishing that program. Immediately after finishing, I decided to just keep going. So that's when I enrolled at WT. I did their BSN program. And
as a young mom.
As a young mom with two very young children.
That's impressive.
It was not easy, but it was absolutely worth it. After finishing the BSN program at WT, I worked as a staff nurse in the neonatal intensive care unit at Northwest Texas healthcare system.
Okay.
I was there 4 or 5 years, at the same time working on my master's. I knew that I wanted to do more. I didn't know if I was capable of it. I didn't know if I had the time. So I just, I guess like a fake it till you make it kind of thing.
I mean, we're all doing that.
Right.
So,
I mean, I figured it out, obviously. But yeah, I was a staff nurse, and then I went back into WT for my FNP, so my family nurse practitioner certification is what I have. And no regrets. I love it. And a lot of people don't know this, but I'm actually an assistant professor at WT in that same program.
Okay.
So I'll be starting, this will be my second year as a instructor in the program that I graduated from a little over 10 years ago.
Okay. I want to ask about being a staff nurse in the NICU. As a young mom still, like, is that a heavy position? I mean, it's one of those things. I know a lot of nurses. You can't bring home a lot of what you do because you see a lot of trauma. You have a lot of high points, but also some hardships. And being around children like that, I would think might be psychologically something you have to deal with.
Yes, it was a tough job. I tell people that there were way more good days than there were bad days. Of course, there were bad days, but being able to see a little micro preemie, a baby that's less than 1 pound, survive and grow and thrive and go home with their family was very rewarding. It was a difficult job, but I wouldn't change it. If I had any option of, like, if you could work anywhere in the hospital, even to this day, I don't think I would work anywhere
You'd
other
still
than
go
the
that
NICU.
direction.
Yeah, absolutely.
So at what point did you start thinking of moving beyond a direct care hospital kind of setting?
I really needed a job that accommodated my kids' lives.
Okay.
That was the biggest motivator, is I need a job that's 8 to 5 so that I can take my kids to school, pick them up. Shift work in the hospital is great if you're young and single. But when you have a family and you have responsibilities and your kids have programs at school and all these different things, it's hard. I was having a lot of days where I actually worked nights, so I was available during the day, but I was like a zombie.
Yeah, that's when you're supposed to be asleep, right?
Right, I'm supposed to be asleep. So I was, I was going to things, but I wasn't able to be as present as I wanted to be. And so it was a really difficult sacrifice, not just for me, for my kids, for the people close to me, my sister, my mom, because, it takes a village.
Yeah.
It's not just just me doing it by myself. I needed that support. And so it was a huge sacrifice, very well worth it, but also very difficult. It was a hard decision to make.
So what did you end up doing then?
So as far as work?
Yeah. So once you decided, okay, shift work is not going to be for me, then what do you do next?
I went to school.
Okay.
So I enrolled at WT. I went through their program, graduated, passed boards, and then I started working at Haven Health, which is healthcare it's women's health. So I worked there for about a year, loved it. I loved the patients that came in. They were mostly young women who needed help. And so, you had your run of the mill exam, come in, get checked out, get my prescriptions, move on with my life. But you had a lot of women that were coming in who, first of all, had never seen anyone like me in the position that I was in.
Yeah. So there's a representation sort of impact.
Exactly. And so that was 10 years ago. I was 10 years younger. So I was a young African-American woman in that position. And so, that was almost jarring to a lot of people. Right. They hadn't seen anyone that resembled them that was in a position to help them. There was a certain amount of comfortability that came along with that. I did a ton of counseling. So as a nurse, you wear many different hats, right? Counseling is one of my hats that I wore. And I had patients tell me point blank, like, I have these questions. I've never felt this comfortable talking to someone, and I just want to ask you these questions real quick. And I'm like, yeah, of course, So that really opened my eyes to healthcare, the type of providers that are in our area, what type of services are they offering? Are the people, are they able to go somewhere where they feel comfortable?
Right. Who's falling through the cracks because there's a level of intimidation or comfort or whatever that they might face.
Yes. And so that's kind of where, at that time I didn't realize it, but that's where my business model started. Okay. Essentially, that's where it started.
You saw the need for it.
Yes, I saw that need. I was nowhere near being ready to own and operate my own wellness or healthcare practice, but the seeds were being planted.
Okay.
So that's where it kind of got started.
So tell me about the decision then to launch Blumologie and to actually open your own practice, because there's, for many people, you can see a need, but the steps into entrepreneurship, starting a business, going through all that startup stuff is still like really hard. And not everybody makes it to that point. Somehow you made it to that point and then passed it so that you're thriving now.
Yes, and it was not easy. And one of my favorite things to tell people is that you don't know what you don't know. Okay. And there are so many things that even to this day, I still just don't know. I've learned a lot of lessons the hard way, unfortunately. I'm learning them. The seed was planted many, many years ago. I actually ended up leaving that job after about a year. Okay. And I went and worked at the J.O. Wyatt Clinic on Amarillo Boulevard. I worked in pediatrics there for almost 10 years. Okay. So almost the same type of demographic, but more so children. I only saw children. But, when you're seeing kids, you're not just seeing them. You're seeing their whole family. You're seeing the parents. You're seeing their older siblings. A lot of low-income, Medicaid, a lot of refugee families. And so sometimes somebody had coverage and somebody didn't. And so it's like, okay, well, these two kids have this same problem. I'm going to bring in so-and-so, and I need to know what I need to do for the rest of my family. So a lot of that, which I absolutely loved it. I love helping people. I'm selfish in the way that it makes me feel good. Yeah. It makes me feel good to know that I helped someone and that I potentially changed their life. And, and working at J.O. Wyatt, I was, again, in a position where they saw their healthcare provider that mirrored their image. Okay. Right? I was a little bit older, but when I first started, I was in my late 20s. Mm-hmm. So, young woman. You still look very young. So well, thank you. No one on the podcast will be able to see me, but
we'll have a photo later. And
okay. But young woman, young mom. Mm-hmm. So I had a lot of patients that were young mothers. So that was another thing that, they could identify with. Like I said, a lot of refugees, a lot of minorities, a lot of non-English speaking patients. I don't speak any other languages, but, to come over into the United States and to just basically get thrown in this whirlwind of, go here, sign this, do this, you need this card for that. It was very confusing. And so I was able to be that go-between for a lot of those people. If you think about it, like nobody really teaches you how to navigate the healthcare system.
No.
So, we know that you go to the doctor's office, you tell them what's wrong with you, they give you a prescription, you take it to the pharmacy, you get it filled, you take your medication. Well, in these countries that these refugee families are coming from, they don't necessarily have that type of setup. And so they're coming in, they don't realize, okay, you gave me this piece of paper or you told me to go to the pharmacy, but why? What's a pharmacy?
Right.
You want me to take this medicine for how long? Like, why? They don't understand that there are chronic conditions in which you take medication. And a lot of people here who've lived here for years and years don't understand that too.
Or you put the burden on a pharmacist at Walmart to explain what's happening when they're so busy that they're just ready to see the next patient.
Exactly. Or they may not have access to translators, which is also, that was something that we didn't always have either. But we had a line of communication that way. So, trying to set these families up for success, and every time they come in, teaching them how the system works. If you have this problem, you go here, versus, the emergency room being overused. Or the ambulance. They were calling the ambulance because their water was out. There's so much that people don't realize. There's so much education. And there are so many ways that you can really help change people's lives if you just sit and listen and talk to them.
Okay.
So that's probably another one of the pieces of me helping to...
A very formative period then.
Yes.
And so you said it lasted 10 years?
I was there almost 10 years.
How did you know that it was time for something else?
I just knew.
Okay.
Working in healthcare is very difficult. I worked there through COVID.
Yeah.
So that was, just to be honest, it was terrible.
Well, it sounds like a really high intensity job. There's a lot of doctors that can see a lot of patients each day, and then go home knowing that their patients know what to do. They know how to get the medication. With a lot of refugee families, with a lot of people living in poverty, I would think that you carry a lot more of that home with you, concern about it, because you can't just release them into the world and say, okay, now they're going to be fine. We diagnose this. They know what to do.
Right. So, yes.
There's a burden to that.
Oh, yes. Many, many sleepless nights. But yeah, it's hard. It was a hard job. And it was a very difficult job to leave as well. Because of that, because of the relationships that I built, there are families that I had. Mom and dad came in when I first met them. They had one little baby and a toddler. And by the time I left, they had 8 or 9 kids.
Wow.
It was hard to leave that.
Yeah. But a lot of people who were in healthcare during the pandemic burned out during that time and were ready to look for something else, whether it was still within the medical community or not. There was a lot of transition, a lot of change after that period.
Yes, and that period of time really opened my eyes. And I've always ventured out just a little bit. Like I'd pick up part-time work here or there. I'm a single mom, so, I'm raising 2 kids on my own. I have bills and student loans and all these different things. And it's nice to have a little cushion here or there. To kind of help dig you out of some of those holes of debt that you acquire while you're chasing your dreams. So I would do, not necessarily like freelance, but I'd work PRN at different areas. And so even with that, like seeing how different healthcare facilities worked and how they were operated, a lot of them were privately owned by physicians, and, the different types of care that they offer, the different services that they offer. I feel like, again, all of that experience has kind of helped me build on, what I want to do, what my purpose is, and how I want my business.
So when you started thinking in that direction, like how did you decide, okay, this is what my purpose is going to be?
honestly, I can't even say that I've really decided it yet. I know.
Yeah.
But it's constantly a work in progress.
Okay.
I'm constantly trying to figure out how to do the things.
It's not set in stone then. Like there's a lot of room for you to continue to expand your practice.
Oh, definitely. Yes. And so like even just getting started was very, very, very difficult for me. And so this was probably around, I would say the idea kind of popped into my head right before COVID hit.
Okay.
And so during COVID, it's festering. I actually I started another educational program. So I enrolled at Liberty University and I graduated with my doctorate in nursing practice in 2022, I think.
All right. Was that mostly remote?
Yes.
Or did you have to?
It was all remote.
Okay.
I did have like a clinical portion that I completed here in Amarillo. And I went to the campus for the very first and probably last time for graduation.
Right.
So I graduated there but yeah, and so it was all kind of festering during COVID. I'm thinking, how's this going to work? How am I going to make this work? What do I need to do? And it was really hard to get started.
Okay.
It was extremely difficult. Texas is, I don't know if you've heard this or not, but it's like the wild, wild west when it comes to medicine. It truly is.
Yeah, there's a lot of regulations. There's a lot of uncertainty about what we can do and how you can do it.
Exactly. Tons of regulations, tons of boards that, you need to check with this board to find out if you can do this. You need to go here to find out if you can do that. And then, they're referring you to other places. It really, it's like a rat race. Like you can't keep up. You can, but it's very difficult. And so, trying to figure all of that out as a nurse practitioner, I can't practice independently.
You have to have an authority figure.
Yes, a physician.
With an MD.
Yes. I have to have a contract, a collaborating physician in order to practice medicine for myself in the business that I own in Texas.
Right.
Colorado's completely different. I have a Colorado state license. I could move to Colorado today, set up shop, do whatever I want.
Okay.
Florida is a little bit, every state is different. So Florida, they let nurse practitioners practice independently after they've had their license for a certain period of time, but not in certain fields. So you can do family medicine, but you can't do aesthetics. So everywhere is completely different. It's a headache to deal with. It is a headache to deal with. But that was a huge barrier for me when trying to figure out how I'm going to start my business, open my medical practice. So, typically what happens is you're a nurse, you're in the healthcare field, all of these physicians, you go to them, you say, hey, I want to start my own business. Can you help me? I need a collaborating. And they're like, yeah, sure. Put me down. I did not have that experience. I went to many physicians and could not get anyone to back me up.
Why is that?
I have no idea. I have a feeling that I may be portrayed as young, inexperienced, not the typical face of a healthcare provider that you might see.
Well, you also hadn't been working like in a hospital setting because you're at J.O. Wyatt for so many years. Like, does that isolate you a little bit from the larger medical community? Or
no.
Okay, so that shouldn't have been a factor either.
I don't feel like it should have been. So still, like J.O. Wyatt in itself is its own little hospital.
Yeah.
So
was that discouraging to you?
It was very discouraging, very. And I just couldn't figure out why. So I kind of had to, go slip my foot through the back door to get in. And that's what I ended up doing. So I found this company that supports nurses, nurse practitioners, PAs who want to start their own business, but they're based out of Dallas. The name of the company, I know that they won't mind me mentioning it, is NeoWell. It's a brainchild of this woman named Deanna where she saw a need. She saw these nurses that wanted to work independently, that wanted to own their own business. And so she set up her business model to support that. Okay. And so that's how I got started. You know, they weren't doing the health things that I necessarily wanted to do, but so it was more aesthetics, which it wasn't something that I was opposed to doing. But I knew from the beginning that I wanted to be able to circle back into healthcare, into seeing my young patients, into offering more medical versus aesthetic type services.
So tell people then what your practice is right now, with understanding that it's going to grow, it'll expand. But tell listeners like what do you offer now?
So right now I am offering, it's basically a med spa. I don't like to coin it as med spa. That can
be a dismissive term, I think, for some people in the medical community.
So. And
is
I
that
think,
right?
Well, possibly. But I do more than just, Botox or not Botox, neurotoxins or neuromodulators and fillers. So, and that's what the med spa term that's what people think of. You're going and you're getting all these injections. Right. And you're going to have these big old duck lips and you're going to look like a cartoon. And so that's not what I do. I do offer those services, but in a way that is supportive of that individual's perception of themselves, how they would like to look, something that's aesthetically balancing. I want to help you feel better by improving your perception of yourself, by helping with your appearance.
And you said that you want to kind of go full circle to where you're eventually offering more in-depth medical services.
Right, yes. I'm offering primary health care and a direct primary care health model to some of my existing clients. So you have people that'll come in because, they want to fix their face, but they haven't been to a general provider in many, many years. So I'm finding things like hypertension and high cholesterol and weight issues, hormone issues that aren't being addressed because for whatever reason, that person just does not want to deal with it. And so I'm capable of treating all of those things.
And you have been for more than a decade.
Right. And so I'm offering those services to my clients because, they're coming in and they feel comfortable. We build up a rapport. They trust me. And it's not just me saying, oh, you have this, take this pill, go on about your day. It's us sitting down and looking at, why, the whys. It's us being able to have a conversation about their health and me making suggestions on ways that they can improve their health, not just medical, but,
a holistic sort of approach.
A holistic view of, we need, it'd probably be good if you took this medicine, but we also need to work on your diet. Yeah. We need you to exercise a little bit more. We need to reduce the stress in your life. So all of those things really, they go together.
I want to talk about your clients because one of the things we've discussed off mic is that the med spa community in Amarillo doesn't always focus on women of color or people of color or skin with pigment, like you said to me. And that's one way you've sort of carved out a corner of the market for yourself in that, not only are you a woman of color, but like you are able to be comfortable for patients of color who, might not face the same expertise if they go to another place. And I want to let you talk about that.
So, yes, I'm a woman of color. I just really look at my experience in stepping into a quote unquote med spa type environment. Like, how have I felt in the past? Right. I'm looking at all the pictures on the wall and I'm looking at the staff and I'm looking at the treatments that they offer, and there's just not, for me, there wasn't a level of comfortability.
Okay.
And not to say that my practice is only geared towards people of color. Generally, treatments that are safe for people of color are safe for everyone else.
Okay.
And so, by focusing on that, I'm able to offer treatments that are for everyone, for every skin type, tone, and texture.
Okay.
So, it just came from, like, I want to look pretty. What can I use what's safe for me to use on my skin? And so clients, they ask me, what do you do? What do you use? And whenever I'm seeing a client or a patient, I want them to be treated like they deserve to be treated. I tell people all the time, like, I would not recommend a medication, a treatment, anything to you that I wouldn't recommend for my own family, for my mother, for my sister, for my children. And that was before I even owned and operated my own business. That is how I determined my treatment plan. If this was me, if this was my kid, what would I want for them? And so I've just kind of taken that with me wherever I go. And I tell people all the time, if I feel like something, I would be uneasy about doing it or taking it, then I'm not going to recommend it to you until I know for sure that this is something that is safe for you. So.
I know there have been conversations, and I've actually had these on the podcast, talking about women's health, and that for decades and decades there was a lot of testing of medication on men, but not on women.
Yeah.
And so you prescribe the same thing to a woman, it does something different.
Right.
And I wonder, because you are in skincare and you're working with women of color, is there a parallel to that? I mean, are there some products that have only been tested on skin that has lighter shades of pigment or melanin and not,
yes,
the skin of women of color?
The easy answer to that is yes.
Okay. Is that something that people don't know, don't realize? And it's easy to be like, well, this isn't working for me. Well, here's why.
Right. Yeah, I think so. But, it's in knowing that, it's my job to try to change it. And so whenever I'm going to like educational conferences, I'm going to places and I'm participating in activities that address those issues.
I want to ask to wrap this up. You have stayed in Amarillo. You came back after that 1 year of college. Yeah. Did you ever think, once you started thinking, okay, I'm going to start my own business, I'm going to open my own practice, did you ever think about going outside this area, or was it a no-brainer to just stay here and continue working with the people that you've been working with?
No, I've never thought about starting a business outside of Amarillo. I've thought about moving outside of Amarillo.
Well, you could go to Denver, right? No,
exactly.
Have an easier way with the
regulations. And that's the thing. Like outside of Texas, this would be so much easier and cheaper. Basically, I'm paying someone a large amount of money every month just to basically
to follow the rules.
Yes, just to say that I can unlock my door every morning. So, but. Still, Amarillo is the place where I want to touch lives. Like, this is my home.
This week's episode is also supported by SKP Creative, and the team there asked me to talk about the new Amarillo Tribune. If you haven't heard, the Tribune is a brand new local journalism organization, a community-supported, nonprofit, digital-only newspaper. It's offering free public service journalism about Amarillo in this area. My friend Jackie Kingston is the CEO and executive editor, and she's built up a really strong news team for this daily publication. They're providing local coverage about issues we care about. Now, I'm a board member for this project. I won't be writing for the publication. I just do the nonprofit side of things. But I'm really excited about Amarillo Tribune and hope you'll support it. Learn more by visiting amarillotribune.org. You can read articles there. You can sign up for its weekly newsletter there. That's amarillotribune.org, and thanks to SKP Creative for the support. Okay, I'm back with Whitney Dowd. Whitney, this is a part of the show I call 8 Straight. 8 Straight is sponsored every week by Panhandle Plains Historical Museum in Canyon. It's the largest history museum in Texas, and its collection includes an Apache buckskin cap with golden eagle feathers, which dates back to 1870. I just mentioned it because I think it's cool.
Awesome.
It's one of the artifacts they have there. You can see it and learn more at panhandleplains.org. Okay, you're a small business owner. I know you think about the future. I know you think about how your practice might grow. Mm-hmm. When you think of Amarillo 10 years from now, what do you hope for?
I hope that Amarillo can change in the way that I feel like it's a big city, but we have a small city mindset. Mm-hmm. So I would like to see that change over the next 10 years.
There are elements of a small city mindset that some people might view as positive, and there are elements that you might view as negative.
That's true. That's very true.
What are the things we need to grow up out of? The less positive types of that.
Well, I don't want to go into too much detail. So what I was kind of thinking was during the last presidential election, mm-hmm. I saw a major change when they showed the Texas map and the large cities, the way that people were voting.
Right.
I saw a shift in the large cities.
So a lot of blue in the urban areas.
Yes. But
all the rural areas.
Right. And Amarillo kind of fell into the rural portion of mm-hmm. that, which is okay. But I would like to see some of that kind of disperse up into this area of Texas as well.
I think there are a lot of people that probably agree with you, although they may be fairly quiet given the demographics here.
Exactly.
Right?
It's hard to talk about, and I try not to get into it too much.
Okay. But I won't press you any further on it. Other than wind, what does this area have too much of?
Right now, road construction, mm-hmm. which is a necessary evil, but it is just a pain in the butt.
Yeah. It's looking like something that we're going to be dealing with for the next several years.
Yes.
At some point, we'll be very grateful for all the nice, clean roads, right?
Yes.
What does this area not have enough of?
Middle-aged single men. I am single and I'm looking, and I feel like my options are limited.
Yeah. It's, I don't know, single mom, business owner.
Yeah, I'm pretty busy, but,
Got a lot going on, but okay, maybe somebody will listen to this podcast.
Maybe, you never know.
What's your favorite street in Amarillo?
My favorite street has to be Amarillo Boulevard. There are so many excellent restaurants, small businesses. I feel like there's a lot of potential mm-hmm. down Amarillo Boulevard as well. I heard we're getting a Starbucks. I'm not sure, but I do live more on the north side of town, so I live past the golf course, past Wonderland. Okay. And, we have to travel a little bit to get to places.
Yeah, there's not a lot of retail stuff north of Wonderland.
No, there's not.
What you find is a little bit more ag-related because you start to get into the outskirts.
Yes. So I feel like that part of town is really growing.
It is, yeah.
So I think that some better options would be nice.
What's your favorite local restaurant or food truck?
My favorite local restaurant is The Weekends, ran by Mr. Devlon Jones. Mm-hmm.
Right there on Amarillo Boulevard.
Right there on my favorite street, Amarillo Boulevard. I try to visit there at least once a week when I'm in town. The food is phenomenal. The staff, everyone's so friendly. It's he has his business set up like I have mine set up, warm, welcoming.
And I know Devlon, I've never actually eaten at The Weekends.
You've got to try it.
Yeah. It's a large hole in my consumption of good Amarillo food, so I need to make that right. What's the most underrated aspect of living in Amarillo?
Probably people don't realize that we have really pretty sunsets here. Mm-hmm. We have a beautiful sky, and I think the people that live here know. I know that people have come here to film our sunsets. Yeah.
And if you ever live here and then move someplace else, you start to realize, it's much harder to get that kind of sky here.
Exactly.
Too many trees or hills or whatever.
Yes. So,
what's your favorite local nonprofit?
Probably Panhandle Community Services.
Okay.
They offer a wide variety of different services that are specific to the people of Amarillo who are in need. They're open year-round. Mm-hmm. They offer connections. If they don't have what you need, they'll get you connected to somebody that will. And so my mom, she actually works for that company, nonprofit, and even as an employee, they've taken great care of her. So not only do they take care of the people of Amarillo, they take care of their employees as well.
Good to know. Last question. When was the last time you visited Palo Duro Canyon?
It's been a few years. Probably, I would say in the last 3 to 4 years. Me and my girlfriends, we went on a hike. I have this amazing group of friends, and we had made weekend plans to go out to Palo Duro Canyon, and we picked our trail that we were going to go on. And halfway through the trail, it kind of had like a cutoff where you could, I guess, circle back to where you started. So we ended up just taking the shortcut.
Cutting it short.
Yeah, but we had a good time.
Okay.
We packed lunch and we sat and had a picnic and we talked, and so.
Okay. And that concludes the 8 straight questions. I like to close by asking my guests to endorse something. So what's one thing you would like listeners to know about or to experience?
Finding a good church home.
Okay.
I think it's super important to have a place that you can go to where, they're able to help bring you closer to God and to teach you about the Bible and to develop that sense of family. I think it's super important to have that.
Where do you go?
I go to Mount Zion Missionary Baptist Church.
So that is a historic church
It is.
in the North Heights. It a long history.
It's the oldest Black church in Amarillo.
Yeah. I believe Bones Hooks was one of the founders of that church back in the early 1900s.
Mm-hmm. That's true.
Okay.
So.
Well, that's one of those questions when you meet somebody new in Amarillo, you inevitably get asked, where do you go to church?
Right. And that's another thing as a business owner that you don't want to get too much into is religion. Yeah. But I do feel like that's important.
Okay. Whitney Dowd, thank you so much for being on the podcast. I appreciate it.
Thank you so much for having me.
And that concludes the episode. I want to say thanks to Whitney for the interview. Thanks also to Wieck Realty, SKP Creative, and Panhandle Plains Historical Museum for supporting the podcast. And as always, to Angelina Marie for editing the show. Thank you for listening. Hey Amarillo exists on a weekly basis because of people like you, people who listen to the show all the way through to the end when I do the credits. And also the local people who support it financially through patreon.com/HeyAmarillo. Hey Amarillo's executive producers include Patrick Burns, Jason Burr, Katie Linger, Corey Burns, Josh Wood, Wes Reeves, Cindy Graham, and Barbara and Jim Witten. This has been episode 368. My name is Jason Boyett, and I'll see you next week.